Good afternoon, everyone. We're here in Saudi German clinics in Jumeirah. We have with us Dr. Sharmila. She's a specialist orthopedic surgeon. Today we will be discussing about stem cell treatments and therapies for arthritis. So, doctor, can you introduce yourself, please?
Yeah, my name is Dr. Sharmila Tulpule. I'm an orthopedic surgeon with special interest in arthroscopic surgery, especially of knee. And I have been doing regenerative medicine and stem cell therapy for last few years. I have about 25 years experience in orthopedics, out of which last 15 years I've been in practicing in Dubai. So hello everyone, and I hope I can explain everything in very simple language to you.
Thank you, doctor. So I just want to inform our viewers that if you have any questions regarding orthopedic, knee, arthritis, stem cell, please do leave your comments below, and our doctor will be more than glad to answer them for you. So doctor, can we start with regenerative medicine and what is it?
Yeah. So regenerative medicine is a very exciting, innovative, latest, very logical and a natural progression of medicine. Basically, regenerative medicine is when we use products or methods where we either induce or enhance regenerative capacity of a damaged tissue. Okay, so basically, whenever in simple words, okay, if a tissue is damaged, we use natural ways to enhance the healing.
Great. So how is stem cells different from this, or what is stem cells?
Yeah, so stem cells, basically regenerative therapy, we can call it as a cellular therapy, okay, of which stem cell is a very important element. What is a stem cell? Stem cell is, it's a contradiction that it's a very special cell, but it's a non-specialized cell as well. Okay, so I'll just explain to you in detail. Okay, so it's a very special cell. What is so special about it? That it can divide, it can renew itself. Okay, so the cell doesn't die and it can renew itself. It can transform itself into another cell. So like our blood cell, or if it is a skin cell, okay, it's not going to transform itself into a bone cell, right?
Yeah.
Its skin is skin. It will die as a skin only. But stem cell can transform itself into another cell. So that is so special about it. And why is it non-specialized? I said, okay, I'll give you a very small, simple example. Say I'm in medical school, okay, I'm studying for my graduation, okay. Now I have got a general knowledge of everything, yeah. Okay. So if I'm put into orthopedic department for the next 3 years, I become specialized orthopedic surgeon.
Right.
If I'm put into pediatric, I become a pediatrician. If I go into cardiology, I become a cardiologist. Similarly, a stem cell, if it is put in a cartilage, vicinity of cartilage, it will become a cartilage cell. Okay, so that's so special about it. Yeah, so it's a non-specialized cell which can become a specialist.
Okay.
So if I put it in a neurological environment like either spinal cord or brain where there is injury, it will convert itself into the neuron cells. So on and so forth.
Wow.
So it's a very special cell, and it is present in our body, so we can just simply use them and heal whatever we want to.
So when you say stem cell therapy, how is it done, or what is it, doctor?
Stem cell therapy is simply using stem cells to again either induce healing or repair a damaged tissue. Okay. Yeah, so there are various ways in which we can do it. We'll be going into the details soon.
Great. So now that you said it can be useful for the brain, for the spine, for neurosurgeries.
Yes.
In orthopedic, how do you utilize this stem cell therapy?
Yeah, so when you say use of stem cells, okay, we can divide it into orthopedic and non-orthopedic. Me being orthopedic surgeon, obviously I'll be focusing more on orthopedics, but just in a very short way, I'll just describe that stem cells now have been showing very positive results in myocardial infarction, okay, when the heart muscle is dead and you put stem cells there and they regrow, okay, so that's a path breaking therapy, I would say, okay. Similarly in ophthalmology, okay, where there is retinal detachment and stuff, okay, so those also, there are very promising results going on in ophthalmology also. Plastic surgeons are using lot of stem cells to regenerate, obviously, you know, because everyone wants to look young. And neurology, there have been cases where they've been used for complex neuronal diseases, plus some cases of paralysis, quadriparesis, okay, where there is the neuronal tissue is dead and you treat it with stem cell therapy and then it regenerates. In orthopedics, I would say very practically, it is being used actively in neck pain, cervical spondylosis or arthritis in cervical joints. Low back pains have been very successfully being treated with it. Lot of tendon pathologies, okay, like shoulder rotator cuff injuries or bicipital tendinitis, like shoulder tendon issues, tennis elbows, then patellar tendon issues, Achilles tendinitis, which is heel pain. There have been, I get a lot of female patients here, and one of the very difficult condition to treat is intractable coccydynia, which is a tailbone pain which just refuses to go, which is very common in females, and they feel shy to even come to doctor telling about it. And I've seen very good results with stem cell therapy for all this. So the joint issues and of course knee osteoarthritis, whether it is a degenerative or traumatic, post-traumatic. So that's a very major chunk of my practice nowadays.
Great, so I understand that you spoke about the tailbone pain. I have known male patients as well,
yes,
who suffer from tailbone.
Yes.
So what is the reason or cause of this tailbone?
It could be either injury, where there is an impact on the tailbone, where there is fall on seat. Okay, many times, you know, they just slip on the staircase and being hit by the edge of the stair. Okay, that could be one, and second could be post delivery, which is very, very common in females, where there is huge pressure and stretch on the ligaments of the pelvis. Okay, when there is the child is being delivered through vaginally, and it just refuses to heal.
So for the male patients, is there any other way to cure this tailbone?
It goes in stages, okay, like first we start with conservative treatment, and I generally give non-steroidal anti-inflammatory and cushion to relieve the stress on the tailbone, and if it doesn't respond, we give local steroid injection there, and if it is really intractable, and stem cell therapy really helps in these cases.
Great. So are there any side effects of this stem cell therapy?
I won't say that this is magic and there is no side effect. No, there are side effects of each therapy, but the side effects are very negligible, very minor. The most common side effect is like almost 50 to 60% of cases will be having transient pain and effusion, or if it is in joint, or swelling around the site of therapy for initial 48 hours, and it just passes off. Other than that, there have not been any reported side effects, which is very positive.
So there's evidence and this is proven?
Yes, absolutely.
Okay, great. Apart from that, doctor, I'm sure when you speak about stem cells, there should be different ways or methodologies of doing it.
Yes.
So what are the different kinds of therapies?
Yes, I will come to that. I'll try and be as simple as possible. Again, I'm stressing on that, okay? If you find it too technical, please let me know. I'll still try and make it simpler for you.
Sure.
So in the last our live session, we discussed about osteoarthritis and various therapies, and we discussed about the hyaluronic acid injections also, I remember, which is a lubricant in the knee joint, okay? Now stem cell therapies, we can divide them into, to start with, very baseline is PRP, which is platelet rich plasma. It's not a true stem cell therapy because stem cells are very less in platelet rich plasma. It's a plasma, okay, where the platelets are almost 3 to 5 times more than what is there in the blood, okay? But other than that, there are more than 1,000 growth factors in PRP, okay? So it is like extremely beneficial for treating arthritis as well as many tendon pathologies also. So that is first, which is PRP. Second, if it is not responding to PRP, then we can go to BMAC, which is bone marrow aspirate concentrate, which means that we just aspirate, okay, that is with just a needle, we just aspirate your bone marrow and we treat it, we separate whatever is needed for the treatment and we inject it into the joint or tendon or wherever there is pathology, okay? So this is second, which is BMAC, okay? The third one is adipose derived stem cell therapy.
Wow.
Okay, which is this is really interesting, okay, because it is from fat in your body, okay. So it is like do liposuction, so it is 2-in-1, that you're reducing your fat, okay, and we just collect the stem cell and the growth factors from there and then we inject it back, okay. So it's from your own body, yeah, and it goes. Isn't it surprising that there are like millions of stem cells in the fat?
Wow.
So again, that is a very, very useful thing. Only thing would be that, you know, you need to be there in the hospital for the day, okay. It won't be like you walk into my clinic and go with the therapy. No, it will be like six hours in the hospital.
I'm not sure whether you would like to categorize this as a silly question, but
no,
from what you said in the beginning, that the stem cells adapt to wherever you
absolutely
put. So when it is in the fat, it's
yes,
not a good thing because it adapts and becomes more fat?
No, it's not like that, okay. So whatever are the normal stem cells in adult body, they are dormant, which means they are inactive, okay. So unless I activate it, okay, right, there are two ways to do it, okay. I activate it and I use it as a therapy, or I culture it in a laboratory and then we use it. That's a very measured number of cells. And the fourth, like we went into PRP, we went to BMAC, which is bone marrow. The third was adipose, and the fourth one, which is very, very promising, is Goldic therapy, in which we infuse the PRP with gold salt.
Gold?
Yes. Okay. It is called Goldic, which means gold induced cytokine therapy, which releases all the fabulous growth factors and the cytokines which are anti-inflammatory, which induce the cartilage growth and which modulate the immune response inside the joint as well as the tendons also. It has been giving very good results even in low back pain and the cervical pains also. So that is, I would say, a very latest addition, and it is really fabulous.
So out of all of these therapies that you've given us, which one is like best suited and is the downtime is faster?
No, downtime for everyone is as fast as or as slow. It is healing that we are inducing.
Okay.
So this is not, magic that you've been suffering from pain for 3 years, and then you come and you say that, okay, give me stem cell therapy and I should be dancing. No, it doesn't happen like that. Okay, it takes its own time because it is body's healing mechanism. Okay, we are just enhancing it, but it is without much side effects. Okay, which one is the best? I would say that it depends on what site we are giving it into. Okay, whether it is in the joint, whether it is proximal joint or distal joint. Okay, even that makes a difference. Whether it is degenerative tendon disease, whether it is post-traumatic arthritis, whether it is back, upper back, or the lower back pain. Okay, so it will depend on that. But about the downtime, usually PRP will be given as successive 3 to 4 injections spaced with apart 1 week. Okay, so it takes around 1 month for the therapy to go on. So day 1 I give, then day 8 I give, again day 15 and day 21. So generally it goes that way. Again BMAC, there is day 1 and then followed by PRP. Goldic is spaced as 4 injection in 3 weeks. So it generally takes around 3 to 4 weeks for the therapy to be completed.
Great, doctor. So does the patient need to be admitted for this when you're doing this therapy?
No, that's the beauty. You don't need admission. You don't need anesthesia. It is done under local anesthetic. Okay, the basic
and it's
procedure.
Not very painful.
No injection is painless, I would say. Okay, but yeah, it's not painful. The tendon injections are a bit more painful than the joint, but I mean, it is tolerable pain. It is done under local anesthesia, not under general anesthesia, I meant. Okay, you don't need to be admitted. PRP and Goldic injections, they are OPD procedures. You can just walk in and it takes around an hour or so for the injection to be completed. The injections are given under ultrasound guidance. Okay, so they are delivered exactly where it is needed. Okay, so then these are not blind procedures that, you know, we gave and we missed the spot. No, it doesn't happen like that.
Nice. So can these stem cell therapies, when used, avoid surgeries? Does it replace arthroscopy and other surgeries?
Oh, very tricky question. Okay, I won't say they replace, but one, they can delay the surgeries. Sometimes, many times, the surgeries can totally be avoided. Okay, the replacement surgeries are done in advanced stages of arthritis where there is mechanical problems in the knee, where there are deformities, mechanical deformities, either gross varus, or there is subluxation, or there is gross stiffness of the knees. So obviously in that cases, stem cells are not going to do any magic at such a advanced stage. But again, if the patient is completely unwilling for surgery, we can try stem cell, and at least the pain factor and inflammation factor can be reduced definitely.
So doctor, is there an age group where it's more effective? Is it done for all age groups?
It can be done at any age. As young kids, as even teenagers can be, we can do stem cell therapies in them. A lot of times they come with knee pains which are tendinous pains. Okay, the patellar tendinosis or chondromalacia patelli, which is the roughening of the kneecap from inside, and these are very helpful therapies in teenagers also.
So doctor, you spoke about 4 different kinds of
Yes.
stem cell therapies itself. But are all of these therapies available here in the clinic in Saudi German?
They are available.
Oh, wow, that's great. That's really great.
Yeah.
So it makes it more easier for you.
Yes,
to have
yes. We
everything.
can basically it's a stage thing that we can start with PRP with hyaluronic acid. Okay, we can do it in combinations, or there are various ways to do it. If it doesn't respond, and we can just always go to the next level. Okay, generally it will take a month of therapy to be a month to complete the therapy, and we expect the effects to last for minimum 1 year. It may be 3-4 years also. Okay, we don't promise moon in the beginning. Okay, I don't want to increase the expectations, but it really works very well. That much I can definitely say.
Truth be told, it works well.
Yes, it works well.
So before you conclude that a patient has to go through a stem cell therapy, what are the investigations you do to perform this?
Yes, the routine blood tests, including calcium and vitamin D. I cannot overemphasize vitamin D importance. In every talk that I do, I again and again hammer on doing the vitamin D levels and getting it corrected, because it's extremely rampant and it has very widespread effects, okay, which I think daily new effect is being described for vitamin D deficiency.
And thankfully we still have the promotion for vitamin D.
Yes, okay, right. So that is about the blood test. Then routine X-rays have to be done, and the third is MRI. MRI needs to be done before we start the stem cell therapy, for a simple reason that it is diagnostic, as well as I would want to do it after 2 or 3 years as a follow-up MRI, where we can actually see whether the cartilage thickness is being restored, okay, which is great. Okay, till now there has not been anything which restores the cartilage. At least now there are few cases which are coming, and when we have been doing the repeat MRIs, and it is showing regeneration of the cartilage. So not as a rule, but yes, it is being shown.
Nice, very great. So before I could conclude, I would like to ask you one last question. Knee pain is very common, but what cases of knee osteoarthritis does stem cell therapy heal or cure?
That I think is a very good question. Okay. As I mentioned in passing, okay, but I would again like to say that advanced cases of osteoarthritis, that is severe knee pain with deformities, mechanical derailment, subluxations, or severe stiffness of the knee, we need to go in for total knee replacement. We cannot avoid that. Okay. So that leaves us with grade 1, which is early osteoarthritis, grade 2 again early, grade 3 I would say is a very good candidate. Okay, so 1, 2 and 3, so early to moderate, moderate to early severe, those are the cases where we can very well try and give stem cell therapy for knee osteoarthritis. Other than that, all the tendon pathologies we can we've been getting very good results with stem cell therapy. All the shoulder ailments, the patellar tendon ailments, the heel pains, so the possibilities are endless.
So the conclusion is, when we have pain, we don't have to worry or keep in mind that surgery is the only option when we have
absolutely
different therapies like stem cell therapy available.
Absolutely.
So thank you to all our viewers who watched us live today. We were live on Facebook with Dr. Sharmila in Saudi German clinics. It's situated right opposite the Jumeirah Beach Resorts in the mall. So if you'd like to book an appointment with Dr. Sharmila, it's 800-2211. Thank you once again.
Thank you so much.